Hello, and thank you for joining this presentation on the experience of peer support workers in a mental health hospital. I am Fiona Blair, and I was peer support worker at CAMH for 4 years. I also helped contribute to the Welcome Basket Research Project with Dr. Sean Kidd. I'm currently using my knowledge and experience as a service user educator within the education department, and I help roll out TIDES, which is our trauma-informed de-escalation training. Peer support within mental health services has growing evidence. It only took me a Google search to be able to find 30 different projects that speak towards this. When peer support is recognized as an integral role, it has the power to bridge gaps and also help with traditional services. It has the power to transform lives. Peer support workers offer a sense of understanding and kinship within a challenging environment in the context of the hospital. Peer support, done well, can provide hope and role modeling. It can also provide empowerment, life skills, problem solving, and advocacy. Self-regulation from a first-hand appreciation. And most importantly, a person who is perceived as safe that they can relate to. Despite these positive contributions, the role is often poorly understood and underappreciated. Peer support workers can find themselves doing tasks and taking on responsibilities outside of their scope of practice, often as assistants, aides, or stopgaps in staffing shortages. The first-hand knowledge and experience of peer support workers is often tokenized, and they are not often valued for their emotional labor, years of personal development and inner work, or their acquired recovery and healing strategies that they've acquired over time. Peer support workers are often thought of as interchangeable, even though our lives and diagnoses, social determinants, and styles of practice are as unique as we are. These oversights can lead to ineffectiveness of peer workers, tensions within the work environment between colleagues, and the risk of further mental health issues or stress and burnout for the workers themselves. The low pay scale further reinforces the devalue of the role, often starting closer to minimum wage and not taking into account the demands and intricacies of the roles and contributions, nor the extra cost of being a peer worker, accessing, say, supports that we can't get either through benefits or through OHIP themselves. So, our method. One sunny afternoon, we went outside, sat at a picnic table, and were interviewed. Out of those conversations, themes were identified. And the results. Peer support workers discussed various tensions encountered in the mental health hospital, both witnessing what patients are going through, maybe re-triggering a peer worker, or within the professional context. Role clarity has an important theme that led to the success in the position, or in contrast, being considered a token and having lack of direction. Instead, following the roles or developing practices that are more medicalized than they are peer support, of peer support origin. This was specifically found within the language used by the medical model, which clients adopt within their experience, making recovery model difficult to implement. Now, the last point is an important one. It also needs to be identified and addressed. What I'm getting at is that my role came down to an awful lot of language translation or shifting of perspective from the medical model to recovery. So if I ever facilitated a group, I would open up with, so what brought you to the hospital? And more often than not, the response was their diagnoses. So I have depression, I am anxious, I live with bipolar. These are their symptoms, but underneath those symptoms often lies, at the heart of it, trauma. The medical model will identify 80% of our clients do have some form of trauma background, but yet we never actually identify or get to the root of those issues. This can create a codependency within the system and services, as there's little awareness of the contributing social determinants or their effects on the matters that people are dealing with. Peer support done well can be emotionally laborious. To attempt to see patients at a similar rate as our allied staff does not take into account the process, the internal process needed to shift within our roles of open and heart-centered, deep diving, sharing to mental or menial tasks and then back again. The appreciation of the role of peer support worker and the people who fill these positions is essentially important to the success of peer workers within different settings of the hospital, and it's imperative to the success of any peer support worker in a mental health field. The conclusion: education is required for all involved, consumers, hospital staff, the system as a whole, about the role of peer support workers in order for them to work in the most meaningful way, providing holistic, empathetic, and client-centered care. Mental health systems and leadership need to appreciate the unique practices of peer support workers by implementing policies, procedures within the medical model for peers to have the space to perform their jobs in a life-changing way. So I leave you with one last thought. It is far better to give a hand up than it is to force somebody to need a hand out. Thank you for listening. We can all do something to change the system.